All right. Hello and welcome.
Great. Hi, Dr. Kiltz. How are you?
Lisa, spectacular, and hello to everyone.
Welcome to everyone out there. It is our National Fertility Awareness Week webinar, one of our favorite events to do every year, and we have a wonderful, exciting giveaway tonight as well.
Absolutely, and we're here to just share some thoughts and ideas,
Yes.
and answer some questions, and bring some concepts of integration, Eastern, Western,
Absolutely.
how the mind and the body are connected to our wellness, and give away, share
Yes.
to some of those that have, I think everyone here is participated, and
Yes.
we have 3 great winners for that.
Absolutely, absolutely. So the winners will be emailed about halfway through the webinar. I'll let you know, and you will receive your notification in your email. And you can just give our office a call at any time. We'll have information in there for you to contact us. We're so happy to share these cycles with our clients and also to offer this webinar as an opportunity for you to connect with us. Ask any questions that you may have, and if your questions don't get answered during this session, we will have our clinical staff or our healing arts staff take a look at them, and you'll receive an answer within the next week. So don't worry about that. And as well, we will be recording this session, so you can access this video on YouTube again during the week, and it will be up at any time for you to view if there was something that we cover and you really just want to hear about it again. Finally, if you ever want to contact us at any time, you can reach us within the patient portal if you're currently a client, or if you are a new prospective client and you're interested in an appointment, you can give us a call at any time at 1-800-539-9870. And you can also fill out the contact form on our website, and one of our call center team members would be happy to contact you and schedule an appointment as soon as possible.
And answer some of those questions also.
Absolutely. You don't have to be a client to have us help you with some of these questions and help you decide what may be the best path for you as well.
And I do many free phone consultations
Yes.
that are helping answer questions, free phone follow-ups for people, because there's so much information that's really
Yes.
hard to understand it all. And what do you believe? It's a challenge, and I think we're here to share ideas. Listen also, because we're always learning and
Yes.
always growing, and we don't know all the answers, and I've learned from clients who have brought new information
Absolutely.
to us, so that's very helpful.
I actually did receive a question just this past week getting ready for the webinar about supplements, and nutritional supplements it's something that we always run into. If you ever are on a message board for fertility, or even on our Facebook support page, on our website, many websites out there, you'll see an exhaustive list of medications and supplements and vitamins and herbs that you can take. And frequently we're seeing CoQ10 and a couple other vitamin supplements, vitamin D. And many of our clients are wondering, well, what really is the list that we should get down to? If we could boil it down to a few supplements to help egg quality, to help sperm quality, and just for good overall health. Is this something that we need to have an appointment for, or is there general information out there that's okay to go by?
Well, I think that it is a challenge to know. If you're eating a well-balanced diet,
Yes.
in general, you should be getting your minerals and vitamins in that diet.
Yes.
I always say that you got to put it in the brain, you got to put it in the mouth, and then you got to use your body right.
Absolutely.
Definitely, there's some evidence that vitamin D, CoQ10, folic acid,
Yes.
and fish oil, vitamin K, B complexes, all are very important. The prenatal vitamins
Yes.
are going to contain most of those supplements that you need. We know that for many women, they may have diminished ovarian reserve. There's evidence that CoQ10 and DHEA as supplements may help with that.
Interesting.
CoQ10 is important for mitochondrial function for all cells, and we know that for sperm and egg function, very important to take. Dosing between 2 and 1,000 milligrams for CoQ10 I've seen.
Yes.
DHEA, 75 milligrams a day. Vitamin D, I think that most of our patients in upstate New York are probably going to find that they are low in vitamin D levels, and a dosing of 2 to 4,000 a day. Again, these are general dosings. If you're deficient and you could get a level measured, It's a thing that it's a test that I think we should be doing more and more to look. Often when we see that number, it helps us feel more confident that we're doing the right thing.
Yes.
I think that in general, if you're taking a supplement, men and women, along with eating a healthy diet, low carbs, good protein sources, lots of green vegetables, because we know those green vegetables are packed full of vitamins and minerals. Coliform vegetables are really important. I think you're going to find a significant benefit from doing that. Low to no alcohol. And there's some evidence that pycnogenol can help with reducing endometriosis.
Interesting.
And the grapeseed extracts are another important antioxidant that can be taken. So which is the right one? There's so many out there. I don't know the right one, but certainly if you go to the health food store or the health food section, and we sell some of these that I think you're going to get, you know, the majority of what you need.
Yes. And there is, like we said, there is so much information out there, and there are so many. So if you're really lost, if you really just want someone to help you break it down, you can always contact our center. You can speak with our practitioners and our healing arts practitioners as well. Our acupuncturists are well versed in wonderful supplements and Chinese herbs that can help support your fertility and help support your cycle. So there is a lot of information, there is a lot of support. You just have to ask for it here and direct your questions to the proper person that you would like to speak with.
Well, I think that I always sort of CoQ10 1,000, fish oil 3 grams, folic acid 1 to 2 milligrams, and it, you know, you want to make that a total dose. Some people who have some other deficiencies may need more. Vitamin D 2 to 4,000. OPC is a great antioxidant powder that has a lot of those that can be very helpful. I think that's a good start along with the prenatal vitamin.
Thank you. So what we can do is we can also support our fertility, and our clients can support their fertility with many of the practices that we offer here. Yoga, acupuncture, and massage. And while we're focusing very heavily on the clinical side, sometimes it can be challenging, I think, for clients to take a step back and say, okay, well, what am I doing for myself? How am I helping my peace and my relaxation? And so utilizing some of the great benefits that we have here, free yoga for fertility, taking a moment to try acupuncture, as you have mentioned in the past, that there are studies that show that acupuncture does improve implantation. And so trying out and stepping out of the box to try our wonderful approaches here at Healing Arts are a great way to integrate.
Well, I can tell you from experience through encounters with stress, and was shared by a client that she had used acupuncture and an acupuncturist called me and introduced me to it, and definitely there's significant benefits from acupuncture. And the studies are out there that show that acupuncture, yoga, meditation, massage, herbs, there's so many things. We know that stress stimulates cortisol and epinephrine. Cortisol and epinephrine is the fight-or-flight hormone. It reduces serotonin and oxytocin. It brings our blood flow away from our core and so the core, remember, the gut, the ovaries, uterus, the testicles. And when you're in a constant stress mode, many people have bowels, they have ulcers, they have stress headaches, and so it's depressed. There are just so many components that we often want a shot for surgery, and we're really great at that in Western medicine, and we do a lot at Semen Fertility because that helps many people.
Absolutely.
But I would bring the whole package to their care, which is start with the top of the pyramid, which is your brain, your mind. And as you calm the mind is better able to see the opportunities for health and wellness and healing. It's our challenge, though, because our habits are run, eat, and fight. And so when you push against something, it always pushes back. I really want this to happen, and somehow it just isn't happening. And it's a challenge to let go, but in the letting go, often the thing comes.
Absolutely.
And then it allows you to see, well, the proper evaluation is always important, and that's the key to all this. Interesting in medicine, an abnormal test doesn't mean that necessarily is the problem, and a normal test doesn't always eliminate that, because our tests are imperfect. But semen analysis, history of both male and female, other medical conditions that go along with their health and wellness. Then for the woman, looking at hysterosalpingogram, hysterosono, look at the uterus and tubes, are some sort of basic starts, along with pelvic ultrasound, and then there's all the blood testing, and then but obviously many people get pregnant without all this testing, and so it's not necessary, but it helps guide us to whether or not it may be something that is really wrong with the male or the female, or it's something that is it really is always a team sport here, that you want to, when you're recommending supplements or alternative treatments, complementary for the woman, the man certainly should get involved in all of this.
Absolutely. And I think one of my favorite parts of complementary medicine, when I see clients coming into our support group sessions and saying, okay, I've tried this out, I went for it, it helps kind of turn back the clock, in the sense that many of our clients who've been trying to conceive are very good at counting. They know every day of their cycle. They know how many days past ovulation, how many months they've been trying to conceive. And the counting and the sense of control is challenging, especially when we add in medications and we add in blood levels and we add in the cycle days. And so many of them, I believe, find some nice relief by utilizing acupuncture and yoga and massage and focusing their attention on themselves. Now that they're here at our center, they don't have to worry as much about staying on top of what day of their cycle it is. They can let go of some of that control, and they can release that to us, which is very relieving. And then they can just focus on, okay, I know I need to have myself healthy and calm and quiet, and kind of retreat back into eating right and getting sleep and trying to release some of that control, as we had talked about.
The stress reduction, number one, and the studies have shown that simply support group, talking in a group with other women with a similar story, is very valuable. We're herd animals, and when we come together, mostly women, but men too can benefit from this, is when you share your story, you feel like you've released something.
Absolutely.
And that gets back to those changes in the hormone levels, and simply sharing a story. Many of us are afraid to do that, to share that story with others. We think there's something wrong with us, and then we're going to be judged. In fact, by sharing the story, oxytocin, serotonin, up, feel better, cortisol, epinephrine, down, and voila, it often happens. I always say, do or do not, there be no try. Master Yoda, of course. It is about the doing and the less about the struggling. Although, remember, this is, we call it a struggle, and we want to fight against it. The challenge is to imagine that this is actually a gift. The journey and the path is for us to learn something about ourselves that may be part of the factor that is inhibiting our fertility. And obviously, it may be some causes that absolutely need our Western medical care, and it's there. And often it's... Sorry about that.
Sorry.
A little technical.
That's okay.
Often, are we good, Paul? Good. Often the process of the struggle, again, pushes us back. We don't want to participate. And so really the Eastern and Western combined is about helping walk the journey together. That's what this is all about.
And it's wonderful to have all the support and have all these opportunities for our clients, especially to connect with others and couples to connect with others and say, oh, you too, I thought we were the only ones. Because infertility is a silent struggle for many people. Even though we're getting better at talking about it, we're getting better at sharing, it's still something that most of our clients aren't comfortable sharing with their friends and family and coworkers, which is understandable. But it's not supposed to be endured alone. And so here we're able to create a wonderful community where you can have 10 other people in the room say, yes, me too. This is what I'm experiencing as well, and I'm happy to not be so alone. And suddenly you can see their shoulders relax a little bit. You can see their face relax, and suddenly they feel a little bit more confident because they can do this.
And the sharing the story is so important.
Yeah.
It absolutely is. And so when our clients first come in to see us,
Yes.
We certainly are sharing the Eastern approach. We're talking about the Western approach and gaining their information about their histories, talking about the basic testing, semen analysis, the hysterosalpingogram, laparoscopy, hysteroscopy.
Yes.
And that's one of the things that I talk about a lot, because quite often women have endometriosis that is a cause of their infertility.
Yes.
And the inflammatory process inhibits normal egg and sperm and embryo transportation and function. It may actually cause inflammation to the fallopian tubes, damage the tubes, and so by doing a laparoscopy, quite often we can clear that up, and quite often women will conceive after doing that. It certainly can help with IUI. It may help with in vitro, but mostly I think it's a good diagnostic tool to both look, help people understand what it is, and then at the same time treat it. So it's often, I think, something that's missed in standard fertility evaluation in treatment for couples.
Interesting. And so one of the questions that many of our clients often ask are, when should they integrate acupuncture, or when do you feel they should integrate massage for fertility? Because these aren't as quick as maybe taking the epidural injection. They don't necessarily work as immediately. Acupuncture does have nice immediate benefits, but when would you add in acupuncture, say, for an IVF cycle?
Well, I think it's important to add IVF add in early on acupuncture and yoga and stress reduction.
Yes.
Very important to the moment you're thinking you want to improve your fertility chances.
Yes.
Even naturally, it's an important to do. I think if you're on the in vitro IVF journey, then weekly before the cycle for a couple of months ahead of time, help you feel what it's like, because often people get to the time of the transfer and it's like, oh my God, I don't want needles, and they're afraid and they haven't even experienced it, and really you don't even feel them most of the time. And so I think it's important to start the journey early during the stimulation a couple of times a week, and then before and after transfer I think are very important. And there are lots of acupuncturists out there that are also going to help provide both herbal and acupuncture guidance for you based on your individual health parameters, because we're all a little bit different.
We are, and I have noticed a lot of our women with PCOS have had wonderful results working with acupuncturists to get some great lifestyle and dietary changes, because as we know, PCOS necessitates good dietary changes to help encourage a nice, healthy body. And so the PCOS is one of those conditions where you can completely feel lost in all of the recommendations of what you should eat, you shouldn't eat, what you should do, what you shouldn't do. And many of our clients have had nice guidance with a gentle direction, not completely abandoning what they know and what they've worked with, but some good supplements and some good ways to improve.
Well, I always say in order to gain what you desire, you must let go of that which you have and what you know. And so part of this often is whatever problems we're encountering in our lives, it's sometimes it's because we require a shift in our daily habits, in our daily thinking. And it may be a complete dietary shift, or it may be get off the treadmill and slow it down a little bit and do a little yoga and meditation, look at acupuncture. So that those are always the beginning of the process in this. And if someone doesn't like or doesn't feel comfortable with acupuncture, abdominal massage, just general massage. At our facilities, we have massage therapists along with acupuncturists, and all adding these modalities can be very helpful to your health and wellness. Spas are growing, and if you haven't been to a retreat, to a spa, and taken advantage of what simple body work along with mind work can do for you, I highly recommend it, because it is tremendous. And we're born and meant to be joyous and happy every day. And if we can shift much of our experience of life, we then often will shift our outcomes, including our fertile outcomes, and have that conception where we are always thinking, well, it's just not going to happen to me. I'm too old. My AMH is too low. There's always something that we're bringing to the forefront of our mind and convincing ourselves why it shouldn't or might not happen. The real key is I ask all my clients, what are you reading? What are you listening to? How much TV you're watching? Because all these things affect our thoughts, feelings, and emotions, and the output of cortisol and epinephrine, serotonin, and oxytocin. So they're all integrally related, and it's all science. It's all simple science. It's 2 meals a day, eat less, walk more, slow down, don't run, and enjoy wherever you're at and whatever you're doing every single day.
Great. Oh, thank you. Now, we can open it up. Do we have any questions?
Let's go with questions. You're probably tired of listening to us talk. Paul's going to read off some of these questions.
Absolutely. Paul? Okay, thank you.
And we apologize for any technical difficulties. We are improving every day, and we hope you can at least get the majority of this.
Would you recommend massage or acupuncture on the day of transfer with IVF prior to the transfer?
Would you recommend acupuncture or massage?
Day of transfer.
Day of transfer.
Yep.
And the answer is yes. And before and after, pick one, do both. They're helpful.
Absolutely.
Pick the thing that makes you feel better.
Yes.
Because if you're not feeling better and you're stressed about it, it's not going to help. And so I think get some experience ahead of time with one of them.
Yep. Always try it out beforehand.
Do it out beforehand. and absolutely, I think that's important.
Great.
Next question.
Oh, and Chris just let me know that the 3 IVF winners were notified. So if you did win, it would be in your email, and congratulations, and we hope to hear from you soon. Thank you.
How is intralipid therapy supposed to help in IVF or IUI?
How is intralipid therapy supposed to help in IUI or IVF, or help in general with improving implantation and pregnancy rates? And there's a lot of evidence that the immune system is highly active in our fertility. And it is definitely, the immune system is important in implantation, maintaining pregnancy. And there's a lot of evidence that natural killer cells seem to be elevated in the uterine environment, and it may be systemically in women with a history of infertility, repetitive implantation failure, or recurrent miscarriage. And using intralipids or intravenous immunoglobulins seems to reduce the natural killer cell levels or bind up the antibodies that seem to be critical in inhibiting implantation. And there aren't a lot of great studies on use of intralipids, but IVIG has been used for years, and the mainstay seems to be a reduction in natural killer cells. And more we're utilizing intralipids days to a week before IUI or IVF embryo transfer. But certainly for women with just repetitive losses who seem to be getting pregnant naturally, it's worthwhile using that. The beauty of intralipids over IVIG, it's a lot less expensive, so it's $100 or less compared to thousands of dollars. But I think that if the intralipids isn't working, I highly recommend looking towards the IVIG. If you look at Alan Beer's website, and his book is Your Body Baby Friendly, there's a lot of great information. And we're finding more and more that I think the black box of inflammation, of implantation is inflammation. So supplement dosing all over the place. You really should possibly check some levels, but I'm recommending CoQ10 1,000, DHEA 75 milligrams a day, folic acid at least 1 milligram. Some people may need up to 2 milligrams. Fish oil 3 grams, vitamin D 2,000 to 4,000 units as a good start. And then a prenatal vitamin.
What level would you recommend
TSH levels before embryo transfer? So thyroid function is very important. And the interesting part, it's always on the move. And 1 week you'll get a TSH of less than 2.5, and typically less than 2.5 is the level we're looking towards. So you might have a 3 or a 5 and you still are considered normal thyroid function. But when it comes to implantation and pregnancy, it seems to be a better functioning implantation and outcomes if it's less than 2.5. And we're now measuring the TSH even at the beginning of cycles, and now looking to incorporate it towards the at the time of the transfer, because I think stress affects it. The immune system affects it, and you could be on your thyroid medication and it be perfectly in line, and then suddenly it goes out of whack. And I think it's likely back to stress and the immune system, the antibodies. So I think it's important to follow closely. The question is reciprocal IVF, and I don't understand the question, so I'm sorry. Maybe we can have someone repeat that or explain it, and we'll be glad to answer later. Different protocols in testing. Well, we're always looking towards different protocols in testing, and if you have something that maybe we're not doing and you'd like us to look at it, we're absolutely there. And we're recently had a lot of looks at some older protocols we've used in the past that some others are using, and so we're open to new and different things. We're using more growth hormone, Neupogen, mixed protocols, and so between estrogen priming protocols, the birth control pill with long Luprons, so even beginning to look more at both natural cycle IVF. We've had doing that a lot more, where it's your own ovulation, monitoring, a trigger shot, one follicle, and working to make that even more affordable. And then the other is low stimulation, a combination of Femara, low-dose gonadotropins, and an antagonist, and finding good results with that. So certainly if there's a protocol that someone out there thinks that we should be looking at, we'd be glad to.
Absolutely. You can always pass it along.
Are there any dangers with IVF fertility? Well, there's dangers to get in a car and drive every day and wake up and go to a restaurant. And so certainly IVF has some risks. Taking the medications and doing stimulation, hyperstimulation, cysts grow in the ovaries. You can rupture a cyst and need surgery. An infection can ensue. There's been some reports about the fertility medications linked to ovarian cancer. And then there's multiple pregnancy, and then the emotional process of going through all this and nothing happened, or a miscarriage. So there's lots of risks in this. I think that the benefits overall outweigh the risks, and in general, I think we're always working to minimize and reduce the risks if we need to cancel a cycle or really warn someone that it's better to do something a little bit differently. We're there.
All right, something for the IVF cycle. If the first cycle doesn't work, do you recommend starting next month or waiting a month or two?
The question is whether to go right from one cycle to the next for IVF. The same would be for IUI, I think, or do you take a couple of months off? I think it's always good to step back and take a month or two to just look back over how you've responded, any changes in protocol, medications, dosing, amounts are really important. To stress, that's the number one reason most people will drop out. So continually working on the stress process is very important. So I think there are more benefits to giving it a month or two than there are reasons to go right into it. Although there are some people that want to go right into it, and it may be reasonable. But I would say, in general, the recommendation is step back, take a moment, reevaluate.
And I think one of the main concerns that clients have with taking a month off is they're losing time. It's another month, it's another month. But we try and shift that focus, especially in our support group session, that a month off from medications and treatment isn't a lost month. That's a month to focus on you, to improve your fertility on your own by reducing stress, by working on diet, by adding in something new and different. This is the month that you commit to taking, 2 10-minute walks a week, and that's something new and different that you're doing. And it's going to be a brand new month when you come back into it, a brand new cycle. So it isn't lost time. It's time spent on improving you so that you can come back with the most peaceful and healthy body for us to work with.
What are some good supplements for men with low sperm count?
So men's male supplements, and I think it's important, the same as women. Adding arginine, L-arginine is important. Yes. The CoQ10, vitamin C, all important components to that. Staying out of hot tubs. I think for a lot of men, looking for varicocele is important. For men with varicocele, having them repaired, there's some different ways to do that, and also looking at acupuncture and massage can be very helpful for that.
Wonderful.
And there's some great general male fertility supplements that contain most of these supplements in them. Favorite thing about Fertility Doctor? Well, helping grow families and making babies is really a wonderful thing to be part of. It can be very challenging and stressful at times, and I think that's much of the reason why I've stepped much into the Eastern and holistic process to help me and then help our clients. Yes. But what better thing than to helping them build a family? And for me, it's also been not just about building a family, but helping them through the journey, whether or not the outcome is a child. We provide discounts for IVF. I don't know the exact number for cash discounts, but we certainly, I've often said the Walmart of IVF, and I work to be the Ritz-Carlton of service. And we're really working to provide a more affordable fertility care. And that's, as I started IVF 20 years ago nearly in my own center, was how do we make this more affordable and accessible for more people? So we've done that via multi-cycle discounts, some cash discounts. Mostly it's about we self-finance, no interest over a year, and we're always there to work with people and talk about their particular finances and situation and how we can make it more affordable. The New York State grant program is still available. And there are also some of the pharmaceutical companies are providing discounts and complementary medications for some of the fertility treatments. So there's so much out there. If you ask, you have a 50-50 chance of getting what you want. So always ask.
And our financial team, Tracy and Lori, are great at helping clients figure out where they fall into kind of the brackets of, well, can they qualify for some of the medication benefits that we have? Can they qualify for the grant? How can we help? And then we have a lot of renewed energy, I believe, with the minimal stimulation, the mini IVF. It's been a great resource for clients who need IVF, but the medication cost has really been hindering them. So being able to pursue IVF with the minimal medication has really saved a lot of clients and allowed them to be able to keep pursuing this.
And the other part to the minimal stimulation is that many people don't want to freeze embryos.
Yes.
And so if we're getting 2 to 3 eggs and we're going to make 1 to 2 embryos, great. The important part to know is that for any extra eggs or embryos, we can freeze those. It's included in our self-pay packages that can be used at a later date.
Absolutely.
How many failed IUIs is too many before moving on to IVF? Good question, and I don't really know that answer. The more you do anything, the more likely you are for something to happen. 3 to 6 IUIs is reasonable after, I think, a careful evaluation. Some people, it's time earlier because, you know, they have some tubal damage, endometriosis, or they have a low sperm morphology or motility. It's more reasonable more quickly. But if it's an unknown cause, you're less than 35, it may be reasonable to do more than 3 to 6. Individual, look at your coverage, your finances, and we're all looking to provide the most natural process possible. And I think that's one of our reasons why we're looking to do more natural cycle, single follicle IVF. You give it a do and you don't know. So in general, 3 to 6 is that number. And I generally, again, recommend the laparoscopy, hysteroscopy for the IUI because many times you find a little bit of endometriosis, a little bit of scar tissue. You're able to improve the odds with the IUI in combination with yoga, acupuncture, massage, meditation, herbs, and read something good, positive every single day. Enough of the crime scene stuff and the unreality television. Everyone has good credit. We're not a credit determining. We provide a service and we offer discounted. And in general, my sense is everyone wants to take care of their responsibilities. So that's not something they're out there to look at. And if people have any challenges, we're always there to find a way to help them through the process. Low responder to medication. So someone with a low AMH, diminished ovarian reserve, maybe their late 30s, early 40s, but again, women at all age may have a low ovarian stimulation. So typical gonadotropin stimulation for IVF might be 300 of a gonadotropin, and you can go higher dosing. That seems to be the way we've gone. I definitely recommend one, adding acupuncture massage, visualize really great ovaries, and then look to adding DHEA, CoQ10, very valuable in the process. We've been using the estrogen priming protocol, and the estrogen priming is typically Lupron and estrogen, oral patch shot in the luteal phase a week before your period approximately, and then you stop that, and then you're starting a standard dose gonadotropin, 300, but you may even still do a little lower, and then add a little either Neupogen or growth hormone to the process that may be helpful, along with abdominal massage for blood flow, acupuncture, yoga, meditation for blood flow. Other part of that is if you have evidence that you're only stimulating a few follicles, then using letrozole, Femara. I've switched from Clomid mostly to that because I think people tolerate it a little bit better. We seem to be getting a little better outcomes, along with low-dose gonadotropins is a nice way, because if you're only getting 3 follicles, that may be all you need in the process to get 3 eggs. Do the supplements, do the acupuncture, and look to adding the DHEA to the process, 75 milligrams or 25 milligrams 3 times a day for 2 to 3 months. So get on these things and work to make it your daily habit of using these supplements. A good AMH number. Well, I don't really know what that is, and that's a tough one, because labs are all a little bit different times of the cycle. We used to think that it's like the greatest number this can be because it's not affected by your medications or other things you're doing in your life. But in fact, we're finding more and more that AMH levels change. They may be affected by stress, by birth control pills, by your immune system. But in general, an AMH greater than 1 is good. Some women with AMHs greater than 2 to 3 tend to have polycystic ovarian syndrome, but younger women with more ovarian reserve tend to have higher AMH levels, which is used to give us an idea of what your probability of success is, but it's really more of an idea of probability of your chances for just making follicles and getting eggs in this. Good follicle count and size for IUI. Well, we're working towards 1 follicle for IUI, and 16 to 18 millimeters is a good follicle number for both natural and for femara. We tend to grow them a little, for natural cycle and gonadotropin, 16 to 18, and maybe 18 to 22 millimeters for our femara and clomid. But unifollicular, if you're getting 2 or 3, and you're in the 35 or over range, the odds for multiple pregnancy isn't as high, and this is about the more follicles, the greater your probability of success in the process. But we want to balance it with your risk of multiple pregnancy, because much of what we're working to do is 1 or 2 embryos for transfer, nothing more, and IUIs for women who have 1 to 3 follicles. More than that, your risk increases. We can often convert you to IVF, and you should ask about that, and we have lots of ways to do that. Can a person ovulate twice in a month? So I think you're meaning twice in a cycle. So typical cycles are 28 days, ovulation day 14. So if you have a 30-plus day month, you could technically ovulate twice in a month. But in general, we think you're ovulating once in that cycle, usually about 2 weeks before your menstrual cycle. So if you're having regular cycles every 30 days, you're likely ovulating about day 16. If you're having 28-day cycles, you're likely ovulating about day 14. Does low AMH and ovarian reserve mean low quality eggs? And not necessarily, because many women are only recruiting a few follicles, and they still have good quality eggs. But in general, the low stimulation and low AMHs may correlate both with quality and quantity and outcome. But remember, these are loosely affiliated. They're good, but they're not great, and so you don't want to hold too tightly onto these things. You might look at them and say, okay, what do we do to boost my quality? And all the things that we've talked about is that's what it's about. Any benefit to doing a natural IVF? Say that again.
Versus a regular.
Natural versus a regular IVF is the question, and It's really dependent on what you feel comfortable with. I would say that natural IVF is a unifollicular, one egg. Your probabilities are a third to a fifth of what you would be with the standard IVF, but I think it's certainly well worth it. With the standard IVF, we're using gonadotropins and stimulating the ovaries, typically getting 5 to 10 eggs on average, where a natural cycle we're getting 1. That said, I think we need to be looking more and more at natural cycle and recognizing that if we can do it for a lower cost, even no anesthesia with just a little local, we can make the process a lot easier for everyone in the process, because IVF is expensive, and probabilities aren't 90%; they're in the 20 to 40% range in general.
I think many people are attracted to natural IVF. I'm seeing clients who maybe they like to take a stand back and not be so intensive. And so I think a regular IVF cycle for some people can feel very intensive and very involved, and with a larger burden on their body of medications that they may be ready to approach yet. So a natural IVF cycle, if they're kind of in that in-between stage where they feel like they do need an IVF cycle, but a natural one is a nice in-between for them where they don't have to go all the way in with all the medications yet if it's not necessary at this point.
Absolutely. I agree with you, Lisa.
If you move the table, we're having a little bit of light issues. Move the table if the light's reflecting on it. Sorry.
It's in my eye. Great, Paul. Thank you. I knew cameras were bright here. Didn't know so bright. How many eggs in a PGD cycle? Well, the challenge is that you're going to generally make the eggs you're going to make, and so for PGD, it's about embryos, and it depends on what the reason for the PGD is. So pre-implantation genetic diagnosis or comprehensive chromosomal screening, lots of new words we're using where we're biopsying an embryo, determine gender and its chromosomal components. Is it Down syndrome? Does it have multiple abnormalities? Or looking at single gene disorders. So more than 5, I'd say 5 to 7 is good. If you have 3 and that's what you're making, often we can biopsy then freeze, and we can then bank the results and do it another time. So there's ways to do it where you can bank more embryos, but I would say 5 to 7 is a good number for that.
Somebody is overstimulated with the lowest possible dose. Will IUI not work for me?
So someone was overstimulated with a very low dose and canceled an IUI. One is it could be converted to IVF. The other is this is where utilizing, if it's polycystic ovarian syndrome, some low-dose steroids. I've been doing lots of ovarian acupuncture or ovarian drilling. That seems to help desensitize the ovary, allow it to respond to the lower doses a little easier, along with acupuncture and some eye massage. Metformin can be helpful in the process. And then using letrozole or Clomid longer, so rather than 5 days of letrozole, do 10 days of letrozole, and then overlap it with a very low dose and low and slow. So the trick is you use 25 units of gonadotropins daily or every other day, and just watch it very carefully. And often there's a knee jerk to like, well, nothing's happening, let's add more, but you got to just go slow. Well, we're working on a center. So the question was, do monitoring for people from coming out of town. New York City, we see people from all over the world, and so a local OBGYN, a local radiologist, lab can do that. We're working with Dr. Vidali in New York City, who's going to be start doing monitoring for our clients and working together. So we're working to make that satellite much more convenient for our clients, and then they could either come to Syracuse or New York for the retrieval and the transfer. But often asking your OBGYN, or we'll work with your local fertility center in your area, can make it a lot more convenient for you. So decreasing vigorous exercise, like spinning and running, and boy, it's the endorphins that are pushed in our bodies that make us feel good. I call it cocaine, and I used to do it. I think it makes you feel good, but it also stimulates the stress hormones. I think for any fertility treatments, work to slow it down a little bit. I'd say spinning is probably better than running, but if you're doing something that's light and easy, and you're working it into a routine along with yoga, meditation, a well-balanced diet, less is best, then I think you're on the right track. So it is a challenge for us who are in that running mode to slow it down. Start cutting in half, maybe do a little less time, a little less vigorously. We think that our heart is, we need to sort of like get it working. Well, it's beating all the time and it doesn't stop working. And it's amazing what you can do with your mind. So that's my take on it. Really slow it down. I think it will help in the process, but it's a challenge because so many of us need it that if we try to do less right away, we fall apart. So take it slow and easy. As you do something else, before you let go of that other thing, you get comfortable with the something else, like walking, like yoga, and the riding. Again, I think the bike riding, the spinning is probably a little bit better if you're not going up too many hills. Is sex okay for the FET, frozen embryo transfer, before and after? And sex is okay, and so we give you a prescription for it. It's good, and there's a lot of evidence that orgasm before and after may help with implantation. And I was just reading a recent study that said basically if you're laying down on that table afterwards too long, it may inhibit your success. So somehow the motion and moving and orgasm are helpful. Plus, this process is so stressful that often our sex life goes away, and we got to stop trying. It's this time, let's do it. It really is set the mood, do more dates, get the candles, and okay, a little wine from time to time is okay, and you gotta play. And life is meant to be played and fun, and so before and after is okay. Usually, just after an IVF retrieval, we don't recommend because you get a procedure. The ovaries are big. It can be a factor, but a few days later, around the time of transfer, is okay too. Caffeine consumption. I don't know the numbers too much. More than 3 to 5 cups a day is probably too much, and it's. I'm not convinced that the caffeine is bad for us, but 1 or 2 cups is likely a good number.
All right. How many tries does it take for IVF for success?
Just male factor, or how many IVF attempts for success? Well, it's never just male factor because it always takes a male and a female in this process. And that's the frustration and challenge. But in general, you're looking at about a 40% delivery rate per cycle for male factor, a normal female under 35, but you have to have some good sperm there. So some of the male factor is no motile sperm, really bad quality, and it again, is part of the components of all of this. You may be in the 20% per success rate. So how many times before you decide, I'm going to give up? Because that's really the challenge. I've seen so many people do it and do it and do it, and it's like, how can they keep on doing it? And then it happens where many people, and most, actually never show up. They give up quickly because it's too hard emotionally, 1 or 2 times. That's really what most people are doing. So my recommendations are, it's a good try, don't like that word, is probably 3 to 6 IVF or IUI attempts in any of this before it's time to reevaluate and look at whether or not you should keep on going. We don't have the ability to say it will never work or it's going to work. And so what I've found is the people that can find the strength and the emotions to find some, I want to say, some joy in the journey, in the process, they're able to keep going, and they're able either to get that success or they're able to see another opportunity that they otherwise didn't see before, and it shows up.
Yeah, some of those great stories, they're just relentlessly hopeful. Just every month they just come right back, they just stand right back up again and say, okay, well, what can we do differently this time? What else haven't you thrown at me yet? And they just keep coming back. They do.
One step from failure, if you make that step, often you'll find success. And that's part of what I believe is the biggest benefit of Eastern and Western is with that support, you can feel better and you can feel like you're going in the right direction, or you can see that other thing that's like, oh my God. And it's an amazing part of the journey. 3 or 5 day transfers, which are better? Well, that's not an absolute black and white. In general, day 5 or 6 blastocyst transfers are likely better because we're picking those people that have the embryos that get to that stage, which are more likely to implant. Some people just seem to make embryos. They look great on day 3, but they never look great on day 5, and they never have a blast. And some of those may benefit from transferring on day 2 or 3. Some people believe that there might be a link to a sperm abnormality. I think it's a combination, but I'm always saying if one thing doesn't work, do another. But in general, day 5 or 6 transfers are better because those people that are making them tend to have a better probability and allows us to choose better. Our next level is likely going to be screening most embryos for chromosomes, genetics, or the comprehensive chromosomal screening, and then we'll be better able to pick the chromosomally normal incompetent embryos. Since we know that at least 50% of most of women's couples' embryos are chromosomally abnormal. How do I feel about aromatherapy? Well, all of our senses require an input from our environment, and quite often we're missing the aroma part of it. Light a candle, use some of the oils on your skin or in your environment, and along with some, I always say, a little soothing spa music in the background. Colors and textures are important. Not that I'm a great painter, but I throw some color on some canvas occasionally, and it adds something to your life. And so we're visual, we're auditory, tactile, and olfactory, all important. Obviously, add that to your life. I think it's healing and health-provoking. Art. Most of us are sitting around watching other people do something, watching TV. Get up, learn an instrument, paint, draw, write. You'll find that you are creative and a genius and capable of so much. This is therapy that'll make you feel better. When you feel better, amazing things happen in your life.
And one support group session we started talking about this, and at first it sounded ridiculous, but we talked about how it's important to create a sacred, peaceful space in your home. And we spent a lot of the support group session actually talking about cleaning and decluttering. But when you think about it, you wake up and you have to hop in the shower, then you have to get in the car, and you have to go sit at work, and then you go to the grocery store. You need a space that is peaceful and inviting and exactly what you want it to be. So we talked about making it be maybe the living room or the bedroom, or it's the bathroom, someplace in your home that you focus on, and you clear out everything that doesn't need to be there. You only surround yourself with beautiful things, comfortable things, and what you would want to walk in and say, oh, I don't want to leave this room for a while. And make that your safe space where you're relaxing, you're rejuvenating, and you can just surround yourself with everything that you love, because so much of our day is spent out in the world surrounded by chaos.
Make the best space in the mind, and imagine that whatever space you're in is that perfect, beautiful space. That's the first step. Absolutely create at home, at work, in your car, wherever you're at. Remember, it's a choice to be wherever you're at, and it's a choice to determine what the experience is. When you can begin to practice that, that's the next amazing part to all of this.
Yep, sure.
Keep going, Paul, please. Minimal number of sperm needed to collect for IVF. If you have 5 eggs, it's 5 sperm. And so an ejaculate may only have a few hundred or less in a grid, and 1 sperm per egg is all we need. And often that's all we get. Sometimes you stick a needle in the epididymis or the testicle directly, and that's all you get. It doesn't really even need to be motile, because non-motile sperm may be chromosomally and competent to fertilize an egg and create a pregnancy. You never know unless you do. So for IUI, in general, we need a few million, but I've even seen some pregnancies with a few 100,000 with IUI, but 1 egg, 1 sperm is all you technically need.
How were the winners chosen?
Well, Chris Briel asked me to pick 3 numbers, and I gave her 3 numbers off the top of my head between 1 and the number. I had no idea the numbers, anything. I just threw them out. And so for me, you're all winners. And if you keep on focusing that it is all possible and affordable. And one of the concepts I thought about recently is how, people say, well, I can't afford fertility treatments. And then I said, well, how are you going to afford that child when that child shows up? And, well, how much is that child? Well, that child per month is going to be anywhere between $500 and $1,000 extra. Where are you getting that? And so if you imagine right now you have that child and you put that $500 to $1,000 in your bank savings, that you'd be amazed that you can afford almost anything. And I recommend reading The Secret, The Power of Positive Thinking, and focus on reading good words every single day. Start the day with that. Don't listen to the radio, especially the news and the weather. Forget it. You create the news and the weather every day, and if you think it's a bad day, well, that's the hormones you're sending to your body and your ovaries or your testicles and your core. Yeah. Shift it up.
Thank you.
And send the questions, and certainly we'll be glad to continue to work on them. And we certainly enjoyed sharing. We're always looking for new ideas, improvements in everything we do. I always say I'm not the smartest guy around, but I'm more and more willing to learn from our clients, from other doctors, every single day. We stop learning when we pass on to the next universe.
Absolutely.
Maybe I shouldn't say that. We're always learning.
Always learning. Well, thank you very much. And give us a call or email us or send a message within the portal if you have any questions or if you have anything you'd like us to clarify after this. And the video will be posted up on our website within the next week.
And thank you, Lisa and Paul. We appreciate Travis also. Thank you. And blessing to everyone. And focus on the spirit of life every single day. God bless.
Thank you.